Welcome back. The Benchmarks Foundation is calling for increased support in the provision of water and food to communities in mining areas during the COVID-19 pandemic. The historic marginalisation of mining communities has been laid bare by the ravaging impact of the coronavirus. The organisation says there is an urgent need to intensify efforts to help these areas. It also says there's no better time to effect structural and systematic change in mining communities than now, and the industry has to take full responsibility. Well, joining us on the programme to discuss this, we have Susan Moraba. She is a member of the Community Monitoring School and facilitator in the Mpumalanga province, together with Hassen Lorgat, who is the Policy and Advocacy Manager from the Benchmarks Foundation. So let me say good morning to both of our guests. Hassen, thank you as always for availing yourself to us, and welcome. And Susan, to you as well, welcome.
Thank you.
Hassen, let me begin with you. What do the current stats actually tell us about the infections in mines?
Well, there are no specific figures, and we've been demanding that we have a sectoral look at how different sectors in the economy are affected, because that will actually work out for any public commentator, for any policymaker, which sector is the epicenter. Now, you can see the discussion that's taking place in schools, where schools are being stopped from opening, closing, etc., because there's a large concentration of people. Mining is no different. Mining, we think, is one of the epicenters of a virus, and people are getting highly infected. And what we are really concerned about is that the unequal power relations between the mining companies and the communities as a whole. Mining communities are excluded from decision making. So people like Susan and others have to gather in coalitions, groups, write up their own stories, advocate to try and make sure they get a real voice in decision making, because they are denied a voice. So the proposal that Benchmarks Foundation has made to say that no, this is not correct. The mining companies must get involved, must even fund the work that Susan and such groups are doing, but they will not be accountable to the Benchmarks Foundation. They'll be accountable to local community organizations as a way for them to continue monitoring the work of corporations, the devastation that they do to our environments, to the water supplies, to our food supplies. You know, some areas, some monitors have found they can't plant anymore because the soil has been eroded, have been destroyed through acid mine drainage and other such problems. So we need these monitors to be there, but they will be paid by the companies, but accountable to communities. Yeah. So those are our initial demands.
You know, and Hassen, Susan, before I get to you, I just want to continue a little bit on these stats. I mean, when we were analysing the stats, already at the time when numbers were coming up, there was a talk that these numbers were far too low, and they were at least double what has been reported. And I mean, you know, there is the talk that there's a struggle to contain this. I mean, when you talk of the environments that miners are working in, poor ventilation, no social distancing, everything that is meant to be in place is not in place. And that's what we were told. This was months ago, and here we are again. So I just want to get back to these figures that you say, Hassen, that we really don't have accurate figures. Is there nothing to work off?
Well, what we do know is that mining is a labor-intensive employment. So mines historically has profited from large amounts of cheap labor. For 80 odd years, there was a maximum labor policy that employed a maximum pay policy where the pay of black workers was pegged. Workers from Mozambique and others came in, and it was low wages that drove the development of Joburg and the capitals of our country. So we know it's labor intensive. They do not ask mine workers to go one by one down the deep cages of our land, the bowels of the earth. Yeah. No, they go in large concentrations because that's the only time it is profitable. So if we can imagine for a while, because the mines are sometimes 4 hours, 5 hours, 6 hours away from our homes, but imagine the discussions that are taking place in schools, where we say schools can't open, there's not water, there are too many people, we're concentrated. The mines, the cages, you are next to each other, you can't drill without other people there. But we're not the only one who warned against the premature opening of mining. The NUM in April already said, when it was 50% of opening, they said, listen, you are not ready to open the economy fully. Now, 70%, we're almost 100% there. We are finding that infections in the mining communities are very, very severe. And these people have been traveling in and out. When they went home, when the lockdown was there, and when it opened up, they went to the mines. So Marula and areas like that are now highly infected. And Susan can talk about it, coming from coal mining areas. The problem that we are facing is that these people have no access to the Mine Health and Safety Council. It is only for organized workers. Mining communities suffer the same illnesses, right? Bad air, etc., and they die of the cancers, the dust that affects them. These all affect community people, and this is not only in South Africa. In America and everywhere, studies have confirmed that these impacts are severe on community members, yet they are disenfranchised when it comes to solutions to resolving it. We need to have a seat in the Mine Health and Safety Council. We've written to them, and they have no courtesy to reply.
Yeah. All right, Susan, let's get now your view, and let's talk to what's actually happening on the ground. So, Susan, what is the situation in the mining communities as we speak?
As we speak currently now, I'm talking from my experience as I come from the mining affected communities. The impacts of mining around those communities are estimated from air pollution, from dust roads, whereby the trucks are traveling daily, transporting the coal, and also from mine blasting, because most of the mines around our areas are open cast mining. So during the blasting, the dust also is causing an effect amongst us in the communities. And the most common illnesses that are there in the community are TB, your asthma, the breath lung diseases, and most of those illnesses emanates from the air pollution around the coal mining areas. We are not only affected by the mines only, but we also have coal-fired power stations, which are also a problem. And from my experience, I've been doing research since 2016 around the coal fields, whereby we were interviewing people affected by the mines, where we found that most of the people in our areas are affected by the mine dust, where we found that from babies, most babies are born with breathing problems, and they are using the machines to support them to breathe, and some are using asthma sprays. Others are taking medication from the clinics, the hospitals, and those who have money, who are employed, they are going to private doctors for such medications. And it's very difficult for us as communities to really voice out, because the people in power, they don't really listen to us. I'm saying this because corruption is very high in our area, and politicians are also against what we are doing. We try all our best to educate our community activists, to do the right things, to monitor the impacts of coal mining around their areas, to document each issue around their mining communities, so that those in power can hear us, because we are vulnerable and we are also marginalized and we are not heard. So working together with the Benchmarks Foundation and other coalition NGOs, we are trying to voice out so that they can hear us, they can listen to us, and we can also have our own demands in terms of the impacts of mining around our communities, because we have lost almost everything.
So, Susan, let me dig a little bit deeper into what you've told us. Now, one thing you said is that, politicians are against what you're doing and there is widespread corruption. Perhaps you can give us an example. When you talk to politicians, corruption, what have you seen taking place? What goes on?
What we've seen is that during the research that we did in 2017 to 2019, we had to interview some ward councillors, the municipal officials, and from what we get, also the mining companies around those mining communities. What we got is that the mining companies will tell you that we liaise with the municipality and the ward councillors in order to get community views. But those views that are getting to the mines, they are not the views of the communities. They are the views of the politicians and the government. It shows that the mining companies are trying to reach out to the communities, but because of the closing gap that we have with our politicians and the government, we are not able to communicate with the mining companies to put on our views, to say what is it that we want, because the mining companies are willing to assist the communities in terms of certain developments that the communities are lacking.
Yeah. I mean, you haven't even touched on the issue of coronavirus in your communities. You know, the incredible thing is that everything that you've described to us about what the community has been suffering for years, and particularly respiratory illnesses, that was the big emphasis. And we know that coronavirus is a respiratory illness. From your community, do you have a lot of infections? Do they get help? Are they forced to go to work? Perhaps you can tell us what it's like in terms of the infection rate in your community for coronavirus and how they're looked after.
As coronavirus came, most of the people who were suffering from chronic diseases such as respiratory illnesses, they became more vulnerable and they are becoming even more ill. Some of them are dying because of certain infections, because the coronavirus has made it impossible for them to cope. The mining companies are not assisting our communities in terms of medication or the health facilities that they are lacking. We are lacking health facilities. We don't have enough medical resources, and the staff in the clinics also, we are short of manpower. So those people who are suffering from asthma, TB, lung diseases, most of them are very ill, and some of them has passed away. For an example, my late father passed away in 2018. He suffered from cardiopulmonary lung disease, and we couldn't even know at first that he was suffering from that until we went to a private doctor, where the doctor disclosed that he has a lung problem and he won't make it. So most of our neighbors that I've interviewed during the research, some of them has passed away due to lung disease, and others passed away due to breathing problems. So coronavirus has even made it more clearer that the people whom we didn't know were sick due to the air pollution are now coming out, because we are seeing more and more patients lining up in clinics, in hospitals due to illnesses, and they are being suppressed again by this virus to show that the illnesses were always there. Now that the virus is here, all those people are now emerging. We are now seeing more of them. And we don't even have the statistics that shows that so many people are suffering from this, so many people are suffering from that. In that way, we are not even able to get the information to tell us how many people are sick and how many suffering from the respiratory illnesses, because our clinics and hospitals, they don't show, or they don't want to give out that information so that we can be able to know.
Yeah, Susan, I mean, this is what you're telling us is absolutely devastating. I mean, Hassan, this is lived experience on the ground. This is not a paper talking to, research from figures and numbers and economics. These are people, these are real people we're talking about, and their experiences are being documented. And I mean, the fact that figures are being hidden, that the truth is not coming out, that these communities are living in the worst circumstances with no help. I mean, let's come back to this paper and the position and recommendations that have actually come out of this position and recommendations to the mining industry. What are you saying? How do we work with the communities? What do you want from the mining industry?
Firstly, is to recognize there's a power imbalance, right? And that the stories that Susan and them write about, their life stories, is partly therapeutic. We've read 44 stories now by different writers where they speak about a child dying, going to the hospital, a mum, all the experiences around coronavirus, the pandemic, will be on the various platforms of Benchmarks and also communitymonitors.net, which looks at the experiences of coronavirus in the sub-region. Now, these people often are ignored, and we thank your station here and you guys in the morning show for actually highlighting a story of the disposable people, those who do not count. So Susan talks about her dad passing away. That statistic will just be regarded as natural. Natural to what? So clearly what COVID has done, it is put this crisis, as you rightfully point out, Leanne, over. It brought out the what's in our society. Those who are ill get more ill, right? And mining has prepared people for illness because people die younger in the mining areas, right? And the figures that they give, about 14 people died and so many under 2,000 active cases, this is underreporting because the costs have been externalized. You only look at inside the workplace, your workplace. Mining does not stop at the gate of the mine, we say. So they have to count the experiences of the community monitors that Susan so aptly represents. There are also cases that we make demands on, that water is not available. The right to water is there in the Constitution, right? This document of ours, it's there, right? But in reality, we have a dam like the Whoop Dam in Limpopo running through a number of communities through in Sekhukhune. But the communities don't have water. But that water is taken to the mine to do mining. So we're asking for these imbalances to be addressed so that water, sustained food supply, the land must be given back in a way that people can plant for themselves. Food parcels are a short-term mechanism. And ultimately what we're asking, by recognizing these deficits, recognize these activists, provide funds to them in a community fund, even observed by Human Rights Commission and others, so they can do their work of ensuring that the voice of communities is amplified and that they can get justice. We suggested something like 200, and we've written to various of the majors in the mining sector to say, listen, you guys have to act. Recognize in deed and in law, right? Make space in the Mine Health and Safety Council for mining communities themselves, so that they're not invisible. Yeah. They have a real voice to affect change. That's what Susan and I are asking for.
Yeah, Hassan, I mean, we're running into the news, so I just want to ask you one last question, and then Susan one last question. It honestly does feel, and it's been a situation for a very long time, that money speaks louder than health and communities' health, and this is nothing new. This is something that's been there. I mean, even the question mark over, at one point, it was said that in mining communities, they were the COVID hotspots. And then you had something like the mining, I think it was the Mining Council that was disputing all of this. And they were saying, no, you can't be saying these kind of things, and that there's an agenda by the media and this, that, and the next. But no one knows what's going on behind the scenes. But the numbers were there, the figures were there, and we got shouted at for that. So it's a constant battle. Oh, you as well, exactly. I mean, it's a constant
that's
battle.
Right. Because we say they are the epicenter of the economy.
Sorry, Hassan, what were you saying?
We say mining is the epicenter of the economy, they are affected most because they bring people together. It's logical. You don't need a brain surgeon for this. When you concentrate people, that's why we ban sports, because sports people are sitting next to each other. But we don't ban them going down a cage.
Yeah. And it's never stopped. Mining has been the one industry that has almost been exempt from COVID, and they continued under all of these circumstances. And that, again,
our politicians are duped. No, I'm so sorry. They are duped by this mythical figure that is good for the growth, the GDP and such indicators. But if those indicators exclude the life experiences of Susan and others, clearly, what is it worth?
Yeah. Susan, I'm going to leave the final word with you. What would you like to see change? You spoke of your father's death. You spoke of the babies being born with breathing problems. You've spoken of your lived experience. I imagine you've been in this community, living amongst mining your entire life. What would you like to see change?
The change that, as community activist and as a part of the community member who's affected by mining, what we would like to see as a change is that government should also be able to engage with communities and mining companies also to disclose information around communities and assist communities who are affected by mining, not only to come to their areas and mine the minerals, taking all the healthy, the health that it's there, the environmental impacts are also affecting us. So we need change so that they can come with alternatives so that we don't die of this air pollution continuously, but we need sustainable mining in our communities.
Susan, your voice has been loud. We've heard it. Thank you for talking to us. We really appreciate your bravery and the work you're doing. Susan Moraba is a member of the Community Monitoring School and facilitator in the Mpumalanga province, sharing her lived experience being in the community and talking to mining community members and the problems they're going through. Hassen Lorgat, of course, is a policy and advocacy manager at the Benchmarks Foundation. And this discussion about the need to increase basics such as access to water and food security for communities in the mining areas during COVID-19 and even after, it should have already been there before, as well as health services. All right, that leads us to 8 o'clock on the program. Let's update.